Thank you, Mr. Speaker. Mr. Speaker, my question is to the Minister for Health and Wellbeing. Can the Minister update the House on policies to improve the health system and any recent feedback from senior clinicians?
Minister. Order, Minister.
Thank you very much, sir, and thank you to the member for Light for his question, and particularly note the very recent opening of the new emergency department at Gawler Hospital, which has already been a significant additional capacity in his local region, and some of the first of our 150 beds to come online through the course of this year. As the member asks about the health policies, we have a very comprehensive suite of health policies that we are delivering to the people of South Australia. And that stands completely opposite to the absolute zero health policies put forward by our political opponents.
Order! 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 Members to my left and right. Minister.
Thank you. Chief of which is creating additional capacity in our hospital system. And today we were able to check, the Premier and I saw the progress of the Lyell McEwen Hospital, where we are building an additional 48 beds as part of this government's commitment to expand our hospital system. And those beds are on track to be open and staffed in September this year, providing much needed additional capacity for the health system. And that's part of a suite of policies covering everything from our additional inpatient beds to additional mental health beds, which is a key part of the blockages that we face in our emergency department, is people not being able to get a mental health bed when they need them. Over 100 additional mental health beds being delivered across the city and state as part of our plan. But of course, it's not just the city we're investing in our hospitals. We're also upgrading country hospitals as well, with very significant upgrades going into hospitals such as Mount Gambier, Narracor, Kangaroo Island, Port Augusta, Port Pirie, Whyalla, critical upgrades to those local services that have been ignored previously, and we're making sure that we're delivering for people not just in the city but those critical upgrades around the country as well. We've put in place just in recent weeks upgrades to our pharmacy services. So people are now able to get access to 3 24-hour pharmacies across the metro region that have been very well received in the Salisbury area, Clovelly Park and Norwood area as well. Many people utilising those services other than having to go to an emergency department. We've also expanded the scope that pharmacists can do to enable them to assist with UTI infections, to provide those medications when people otherwise would have to go to an emergency department because they couldn't get access to a GP. Of course, we have policies to expand the new Women's and Kids Hospital and put that on a bigger site with many more beds. And sir, all of these policies, we were paid close attention to some feedback from a senior clinician this morning who wrote a letter outlining their thoughts in relation of the policies of this government versus the policies of those opposite. It was in the paper this morning, yes, from a Professor Warren Jones, Professor Warren Jones, who's no historical friend of the Labor Party.
Order. Order.
He says, the Malinauskas mid-term government is in the process of injecting massive and unprecedented funds and resources into health and hospital systems. Ambulance response times are more critical than ramping, and these have been halved since the Liberals left office. As the influx of hospital beds and staff escalates later this year, ramping will surely diminish. Any comparison with the meaningless resignation promise by David Spears is trivial and spurious, and he will surely be protected from any criticism of broken promises since he has no health policy.
Order. 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 Order.